we were with Dr. Farahmandpour, and we had some questions for him. Now, he runs the family practice end of the medical office. And one of the things I had to ask you was, there's so much stuff going on right now as far as sickness and tests and results and everything that's coming out. Big thing, this is the warmest winter that we've had on record here on the island. What type of cases have you been seeing in? Has it been more mild? Has it been more severe? You know, things like that?
Well, to be honest, this is one of the warmest winters we've had in a while. And usually with change of weather and change of season, you do get a lot more colds and infections. As far as the influenza infection goes, there haven't been too many documented cases seen on the island as of yet. But there have been slight dips in the temperature, and so even from those little changes from day to day, people have been coming in with a lot more infections than you would expect. And some of these infections have even been serious enough to the point where we had some resistant strains where we had to send 1 or 2 patients to the hospital or treat the patients with a second round of antibiotics.
Now, that's another big thing that's coming out, is that we're hearing about all these resistance to antibiotics that are affecting people. Do you think it's becoming more prevalent as things are going on with some of these bacteria and germs and viruses?
There's always the threat that resistant strains can come about. Resistance, as I was telling one of my patients today, comes about when too many antibiotics are introduced into the community, and they're mainly spread either through overuse or through the hospital sector where patients get exposed to a lot of resistant strains. And so you want to be careful, you know, anytime. But I don't think it's become such a large threat that we can't get a handle on it. There's always newer antibiotics coming out, and this has helped to help alleviate some of the resistant strains and kill them. But there's always the threat that there's a super infection where no antibiotics will be able to kill it, and what do we do then? So as you know, we were worried about H1N1, and it eventually came and we got past it. So I'm sure by the time that comes, we'll have a solid answer, hopefully before 2012.
Another big bite that's been going on in the medical community, especially here on the island, is MRSA. That infection that originally came from hospitals, it's worked its way into the schools, which has got to be the worst place for any type of infection to be, with all the students and everything, communicable diseases, things like that. Do you see any change with that in the future with MRSA?
I have been seeing more MRSA, as have other physicians in the community. What MRSA stands for is methicillin-resistant Staphylococcus aureus. What most people aren't aware is that Staphylococcus aureus is commonly found on the skin, and it is a common bacteria. Now, where the problem occurs is when their skin is broken down, then you can have infection going on where the breakdown causes the bacteria to have an opportunity to affect underneath the skin and spread. That's one of the problems. And the other is, of course, hygiene and hand washing. The prevention of any infection always starts from hygiene and hand washing. And this has been proven time and time again. And if you're able to do that and keep your immune system happy, eat the right foods, exercise and get plenty of rest, the old medication, fluids and rest, is always the best way to avoid any infection.
And there's also been talk about chicken soup and all the medicinal purposes now that they're finding out. Your mom always said, have your chicken soup,
Absolutely,
right?
Absolutely. It just takes a while before science catches up to what we know to be true.
The other thing with diseases and everything else that's going on, we already discussed the MRSA. You have a lot of other infections that are out there this season that everything's coming back like new and improved now. It's not like something you could just, you took a pill and it went away for a couple of days. Have you seen a lot of that in the office?
It's always a surprise. Sometimes we see a lot of infections, not that we always know necessarily what we're treating. It's called empiric treatment, which means you base it on the patient's symptoms and the area of the body which is being infected, and you use the antibiotic that's most commonly known to treat it. Everybody loves to say, oh, can you give me a Z-Pak, as if a Z-Pak is going to cure the world. But honestly, sometimes you have to take a look at the patient, and the reason why we can't treat over the phone is because we have to see what their symptoms are, where the problems are at, and sometimes the stories can be resolved even without antibiotics, and it's not even an infection they have. They have other problems, and they are already playing doctor and assuming it's an infection. So with doctoring, we will never get placed by robots anytime soon because it's on a case-by-case basis.
And one of the things you had talked about with me right prior to the show is how important the patient's history is, because now there's so much awareness now about drug interactions. You don't know somebody, Levaquin is a big one. A lot of people are allergic to that as an antibiotic. Some of the other antibiotics that are out there, they may be taking a certain other medication. That's why the pharmacies now have that whole thing that they do for drug interaction if something should be prescribed. So doing something over the phone and over the internet is fine to give you like a general idea of things that might come on, but you really need that office visit because they have to have your history and everything else going on like that, right?
Yes, there's actually two parts to that answer. The history has always been the essential key to any decision-making process. It's what we teach the medical students and community. Any good doctor knows that 85 to 90% of your decision making is based on the history, and the physical and the labs are there to support it. Where most patients assume that, it's the labs that are going to determine the deciding factor, when in fact that's only there to help assist the doctor in confirming a decision that he already suspects. The second part is you mentioned medications. Now, there is something important in the community that's more problem-based within the pharmacies and the doctors, and that is the dosage errors and the prescription errors that are going about. And what has happened recently that has helped to fix that is electronic medical records and what's called electronic prescribing or e-prescribing. And throughout the United States now, you have access to any pharmacy where you can electronically send the medication, the dosage, to the pharmacist, and they will get it. It's typed out, it's nice and neat, so there's no handwriting errors. Instantaneous and quick, so the patients don't have to carry the prescription, they can lose it. The pharmacist, 99% of the time, will get it on the other end. But like anything else, you have to watch out because there's always a chance of human error. You have to review the prescriptions, make sure it's sent to the right pharmacy, and the pharmacist always has to check to make sure there's no interactions. And that all comes into play. And some of the interactions are valid, and sometimes the interactions are there, but as physicians, we take a look at them and see how important they really are, because at the end of the day, it's what's best for the patient, and we need to sometimes override those interactions because we know the patients need the medication. And just because there's an interaction, like anything, any two medications, there's always a possibility of that. We have to be savvy enough to know what's better for the patient. We have to know the patient, know the drugs, and be familiar with all those interactions.
Yeah, because it can turn around and be something as from a mild headache to life-saving therapy for the heart or lungs or some other part of the body.
Right, and just to keep it simple, it's basically, I look at it as a one-step process. You want to make sure you take care of the patient when they come in because they're coming in for your services and for your advice and your education. And the first thing you want to do is make sure the patients get better, but I always try to avoid them getting worse to the point where they're going to end up in a hospital and have a serious condition. So that's always running in the back of my mind, and I think most doctors. So you have to be smart enough to know how to head it off at the pass while still providing a lightning sense where the patient won't fear it and won't go home and say, oh my God, I'm going to die, because that's always the back of their mind. Where for us it's simple, we know what's going to happen, but they're not too aware, and they need that reassurance. And believe it or not, the placebo effect of doctoring and the reassurance factor, in my opinion, still plays a good fair amount, like 30% of the visit itself.
Now, one of the things I also noticed with your other doctor associates who we're going to have on later on in the program is preventive care seems to be a very strong thing that you guys push at Heart and Health over in Middle Island.
Oh, at Heart and Health, we definitely believe in preventive care. I myself and my colleague, Dr. Happel, were raised as family physicians, and Dr. Cavestein, who's an internist and cardiologist. When we met, it was the forefront of what Heart and Health represents. preventative care and making sure the patient gets good service, and they come in and they feel like they're getting their value for what they're there for, but also to make sure that they're taken care of. So what is preventative care? Preventative care can be looked at a few different ways. So one of the ways we break down preventative care is to make sure that we go over every aspect of the patient from head to toe and make sure that nothing is missed, to do the usual screening for their age group, and to try to foresee any problems that might arise and try to head it off at the pass. Now, sometimes that ends up helping the patient, but some patients, they ending up having more problems than they came in with. Some of the latest things that we're seeing that's a new trend in the past few years has been vitamin D deficiency.
Right.
Vitamin D we know is essential. It's gotten absorbed through sunlight. It helps with calcium absorption, cell function. But everybody that's been tested recently has had a deficiency in vitamin D. And we try to put them on vitamin D tablets, try to boost them, and then they have been smart enough to start vitamin D supplements on their own even before we get to that point. But it's not as critical as most people would like to make it. I think it's a trend, just like obesity is an epidemic that's worsening. But I remember, let's do the fat reduced diet, then the caloric diet. So there are trends in medicine that will come and go.
And one of the big things was, and because you had just said about the vitamin D and sunlight, was that all those cases of melanomas and skin cancer was coming out. People were avoiding the sun like crazy. Sun 2000 sunblock they were putting on their bodies when they go out. The total opposite happened with the public. They went into like a sun paranoia. About it. I mean, the thing is that, when people hear these things about medicine, and that's the good thing about heart and health, is that they go to extremes. Doctor said I should have plenty of vitamin D, so I'm taking 4,000 milligrams a day, okay? Or I should have 2,000 milligrams of vitamin C. And they don't realize, then they start having some digestive issues or whatever, or something like that. And it just leads into one big thing. So that's why it says on every vitamin bottle and everything else, ask your doctor first. Check with your doctor. And there at Heart and Health, you guys are always open for questions, whether either it's on the phone or in person on the walk-ins.
Thank you. There was two things I wanted to bring up with that, where you mentioned that vitamin D, ask your doctor first. This is the first warning, I guess, if anybody's going to look at this, they should be aware. Vitamin D is a vitamin that's absorbed throughout the body, but it's also stored in the liver. So excess of vitamin D can be harmful to your liver, just like vitamin A or vitamin E. And if patients don't realize that, and they can go overboard. We just had an instance where I believe, I wasn't sure if it's our office or another office, but I heard that one of the patients took vitamin D. They were supposed to take 1 tablet a week, and they took one once a day.
Oh.
So that can become a problem. And so we have to be careful that within the community, patients are aware of how to take their medications and what to expect when they're taking it. For example, like vitamin B and vitamin C, your body only absorbs what it needs, and it gets rid of the rest through different means. So whether you're taking 200 milligrams, 500 or 1,000 or 2,000 of vitamin C, your body might only take in a few hundred milligrams that it needs for that day, and the rest kind of gets washed out. So literally, you're throwing your money down the drain, so to say. So you have to be careful with that. And also, speaking of extremes, that's the one rule that I've always lived by in medicine. Everything in moderation. You don't want too much of this or too much of that, because the body doesn't work in extremes. It actually works in moderation. It has levels in which it functions. And instead of trying to outdo the body, if you work as a naturalist with your body and try to enhance it rather than try to, beat it, then if you listen to your body, basically will tell you what you need. And I think just like kids, when they want that ice cream for 1 week and then the next week they're into this trend, their body is telling them what they need. And as adults, sometimes we don't listen to ourselves as much as we should.
So excess is really excessive as far as your health is concerned, because your body is going to say, this is all I need. I don't need the whole cake. I can go with a slice of cake. I don't need to
Exactly.
drink a case of beer. I can go with one beer. I don't need to take 50 vitamins. Your body only needs one. So the best thing, basically, for these people, if people are watching this program or watching on the internet, and they are like saying, well, I'm having a bit of a problem here and this and everything like that, my back, all these other things, and realize that family practice pretty much covers everything, and anything you guys can handle, okay, you would send them to a specialist or refer. Right?
Absolutely. And we try to, we use the specialist when necessary. Everybody is trained in a specialty for a reason, because it's because they know their area of expertise. As family physicians, we've been trained in pediatrics, taking care of young adults and kids and teenagers. We've been trained in gynecology preventative care, including doing gynecological pap smears. And we've been trained in adult medicine and geriatric medicine, and this is our bread and butter. We learn to deal with all sorts. The old joke goes, the family physician knows a little bit about everything, and that's partially true. We do know a little bit about everything. And if we don't know in medicine, you know, one thing that I like about Heart and Health is we don't try to fool the patient and say, oh, it's probably this or it's probably that.
Right.
We simply tell them, you know what, I'm not sure, let me look it up, and we get back to them. As far as communication goes, our phone lines are always open for communication. We take phone calls, and I encourage patients to always call if they have questions, whether it'll be silly or little question, which to them is probably a big question because, you know, their whole day revolves around that.
Right.
You know, how to take their medications, is this good, an interaction. And even though for myself or other physicians that might seem like a simple answer, for the patient it's probably something big and important. So I don't think any question is ever too little to call. But that's what we don't get. Sometimes patients are not, they're afraid or they feel the doctor won't call them back. And we try to have a policy in place where we try to call the patient back within the next business day usually, unless it's urgent. If it's an urgent message, then of course we will call them back sooner. And for the most part, there's always a physician at hand to answer any questions, whether it's directly talking to the patient or communicating through the medical assistants to relay the message.
One of the things about Heart and Health that I like, and through Visitor and through the footage that you're going to see both here on the internet and on this TV show, is the medical staff. When you walk in, from the time that you're in that waiting room to the time that you're taken to the doctor. How is your interaction with the other doctors, with both Dr. Cavestein and Dr. Haffel? I noticed that them and the staff, you guys really work together. It's almost like watching a football team like the Giants going on over here.
Working with the other doctors is great. I really enjoy it. I've known Dr. Cavestein for a great number of years now. We help each other out and we work with each other, as opposed to, you know, he's right, I'm right. You know, we always try to come up with the best solution for the office that's best for the patients and for the medical staff. As far as Dr. Happel goes, I love working with her. We train together, and I've known her a long time, both as a physician as well as outside of the medical interactions that we have. And her and I and Dr. Cavestein, our philosophy is basically simple: take care of the patient, provide good service, and I think it's enjoyable. We like interacting with the patients. We keep it simple. We keep it happy and delightful. When the patients come in, they realize that they're coming in, but they don't feel like they're at a doctor's office all the time. They feel like they're part of a family. And that's what you want. You want the patient to be as relaxed as possible, and not that they're going into a doctor's office and being nervous. So that is important as far as the teamwork between myself and my other colleagues. And the other part of the office that I love is the communication, and we reinforce it. When there's a problem, we try to communicate and work through it. Because, you know, just passing orders, do it this way, we like it that way, that doesn't work. That's not going to help anybody. You need to explain why, and you need to hear the medical staff's reasoning for what their problems are, and you come up with a solution that works for everyone. And we have several meetings each month, whether they're short meetings or long meetings, to try to resolve these issues so that the patients are getting the best care possible.
So we've been with Dr. Farahmandpour of Heart and Health in Middle Island, and we'll be back with more in just a moment.
Thank you.